Let's discuss the bladder channel points overview. Specific points according to their function. Yuan source point, bladder 64. Luo-Connecting point, bladder 58. Qi point, bladder 63. Qi point of the Yang Qiaomai, bladder 59. Associated backshoe point, bladder 28. Backshoe point of the lung, bladder 13. Backshoe point of the pericardium, bladder 14. Backshoe point of the heart, bladder 15. Backshoe point of Dumai, bladder 16. Backshoe point of the diaphragm, bladder 17. Backshoe point of the liver, bladder 18. Backshoe point of the gallbladder, bladder 19. Backshoe point of the spleen, bladder 20. Backshoe point of bladder 21. Backshoe point of the triple burner, bladder 22. Backshoe point of the kidney, bladder 23. Backshoe point of the large intestine, bladder 25. Backshoe point of the small intestine, bladder 27. Backshoe point of the bladder, bladder 28. Associated front move point, REN 3. 5 shoe transporting points. Jingwell point, metal, tonification point, bladder 67. Ying spring point, water, bend point, 5 phases, bladder 66. Shoe stream point, wood, sedation point, bladder 65. Jing river point, fire, bladder 60. Husi point, earth, bladder 40. Way meeting point of the blood, bladder 17. Of the bones, bladder 11. Opening point of the Yan Qiaomai, bladder 62, lower Husi point of the triple burner, bladder 39, of the bladder, bladder 40, Yao Wei meeting point with stomach, triple burner channels, and Yin Qiaomai, Yang Qiaomai, small intestine, gallbladder channels, Dumai, bladder 1. With small intestine channel, triple burner, gallbladder channel, Dumai, bladder 11. With Dumai, bladder 12. With Dumai, bladder 23. With the gallbladder channel, bladder 31, bladder 34. With small intestine channel, bladder 41. With the Yang Qiaomai, bladder 59, bladder 61, bladder 62. With the Yang Wei Mai, bladder 63. Of other channels with the bladder channel, do 24, GB15, do 20, GB6, GB7, GB8, GB9, GB10, GB11, GB12, do 17, do 16, do 14, do 13, GB30. Gawu command point for the back and lumbar region, bladder 40, window of heaven point, bladder 10. Points of the 4 C's, C of blood point, bladder 11, Madanyang heavenly star point, bladder 40, bladder 57, bladder 60, Sun Si Biao ghost point, bladder 62, other functional points, C cleft point of the Yan Qiaomai, bladder 59. Points according to the region, local points, occiput, bladder 10, eyes, bladder 1, stomach spleen, bladder 20, bladder 21, kidney, bladder 23, bladder 62, rectum, bladder 35, cervical spine, bladder 10, thoracic spine, bladder 17, bladder 23, lumbar spine, bladder 23, bladder 26, bladder 52, iliosacral region, bladder 27, bladder 28, hip, bladder 49, bladder 50, bladder 54, knee, bladder 40, foot, bladder 60, bladder 62. Adjacent point, eyes, bladder 2, nose, bladder 7, lungs, bladder 13, bladder 43, heart, bladder 14, bladder 15, liver, bladder 18, bladder 20, gallbladder, bladder 19, large intestine, bladder 20, small intestine, bladder 27, rectum, bladder 30, bladder 34, bladder 28. bladder 23, urogenital region, bladder 23, bladder 32, cervical spine, bladder 11. Ileosacral region, bladder 23, thoracic spine, bladder 38, bladder 47, toes, bladder 60, bladder 65. Distal points, occipital region, bladder 65, bladder 60, rectum, bladder 57, thoracic spine, bladder 57, cervical, thoracic, lumbar spine, bladder 60, shoulder and iliosacral region, bladder 58, for the thoracic spine, lumbar spine, and iliosacral region, bladder 40, lumbar spine, bladder 40, bladder 59, bladder 60, lumbar spine and hip, bladder 62. Thank you for your attention.
Let's discuss gallbladder 5, Xuan Li, suspended hair, the point of the eye system. GB6 is located at the junction of the lower quarter and the upper 3 quarters of a line connecting stomach 8 and GB7. How to find? First, locate the 2 reference points. Stomach 8, which is located 4.5 tsuen lateral to the midline and 0.5 tsuen within the anterior hairline at the corner of the forehead, and GB7 in the depression on the level of the apex of the ear within the circumauricular temporal hairline. Then divide a slightly curved line between these 2 points into quarters and locate GB6 at the junction of the upper 3 quarters with the lower quarter. Needling is 0.3 to 1.5 tsuen transversely or subcutaneously in the direction of the occiput or towards the disorder or pain. Actions or indications: expels wind and heat, opens the channel. Special feature: meeting point with the LI, ST, and TB channels. GB6 subdues liver yang for headache, dizziness, blurred vision. Opens the mind's orifices for disturbance of willpower, lack of motivation, and speech difficulties. GB6 is an important local point for the treatment of migraine headaches on the side of the head due to rising of liver yang, liver fire, or liver wind. It should be needled horizontally, that is, at a 15-degree angle towards the back of the head. It can also be used for ear problems with pain extending to the side of the head along the gallbladder channel. This point is also used in psychiatric practice for disturbance of willpower, lack of motivation, and speech difficulties. GB6 is crossing point of GBTH, stomach, and LI. Consider GB6 for headaches, migraines, ear problems, or cerebral weakness, for difficulties with coordination of speech or movement, or for a lack of penetrative thought. Can be effective for a person who suffers from timidity, which is referred to as small gallbladder. The point name refers to the need to lift the hair in order to needle it. The gallbladder facilitates coordination and grants the courage to act. When there is disturbance within the gallbladder official, mental and emotional problems, timidity, weakness, and lack of penetration in mental functioning, lack of motivation, speech difficulties, and disturbance of movement can result. GB6 can calm the mind and restore clarity and strength to the spirit and mind. It can be combined with GB9 and 34 for these purposes. GB34 is the influential point for the sinew tendons and can help restore and remove constriction of smooth flow, and this in combination with GB6, which removes obstructions from the meridian, can assist and strengthen the gallbladder. GB6 removes obstructions from the meridian, benefits the ear, and is used for ear problems with pain extending to the sides of the head along the gallbladder channel. For tinnitus, pain in the outer canthus, and sneezing, facial swelling, and redness. GB6 expels wind and clears heat. Important for treatment of migraine due to liver yang rising, liver fire, or liver wind. It should be needled at a 15-degree angle towards the back of the head. Used when there is an absence of sweating in heat diseases. Thank you for your attention.
Let's now have an overview of the points of the kidney channel. First, we have the points of the kidney primary channel. The tonification point is kidney 7, sedation point is kidney 1, and the orifice point is kidney 10. Kidney 1 is indicated for shock. It brings Qi down. Kidney 2 is for fire, especially in the throat. It is also for cramping, for deficiency, and for burning heat. Kidney 3 benefits the ears. It's also good for asthma. It's a general point for general kidney syndromes. It builds yin and yang. It also builds kidney qi and also for deficient heat and deficient qi. And it is the most common point. Kidney 4 is for kidney spirit deficiency and for emotional asthma. Kidney 5 benefits the eyes. It's good for menstrual disorders, for pain around the navel. Kidney 6 is the major throat point. It builds yin and has more effect on the spirit. Kidney 7 builds water. It's good for sweating or no sweating. Kidney 8 is the left point of the kidney, and it's good for clearing. Kidney 9 is for excess spirit. Kidney 10 is the water point of the kidney. It cools heat and nourishes kidneys. Kidney 11 through kidney 15 are for urogenital disorders. They're also for pain and redness of the inner canthus. Kidney 12 to kidney 21 are for abdominal disorders. Kidney 22 through kidney 27 are good for coughing and asthma, and we palpate for tenderness along these points. Kidney 3, 4, and 7 are all for low back pain, whether chronic and deficient. Kidney 2 is for acute back sprain. Here we have specific points according to their functions. The Yuan source point of the kidney is kidney 3. The Luo-Connecting point is kidney 4. The Shik left point is kidney 5. The associated backache point is bladder 23. The associated front knee point is gallbladder 25. The 5 shoe transporting points are as follows. The Jing point, also a wood point and a sedation point of the kidney, is kidney 1. The Ying spring point, or the fire point of the kidney, is kidney 2. The shoestring point, which is also an earth point, is kidney 3. The Jing river point, the metal point, and also the tonification point of the kidney is kidney 7. The Husi point, which is the water point, the bend point in the 5 phase, is kidney 10. There is no point ascribed as the Hui meeting point. And the opening point of the kidney is of the Yin Chao Mai vessel is kidney 6. No point is ascribed as the lower Hosi point. The Zhao Hui meeting points are as follows. With the Yin Chao Mai, it's kidney 2, kidney 6, and kidney 8. With the Yin Wei Mai, it's kidney 9. With the Chong Mai, it's kidney 11 to 21. Of the other channels with the kidney channel, they are spleen 6, Du 1, Ren 4, Ren 3, Ren 7, and Ren 17. No points are ascribed as Gao Wu command point, window of heaven point, and points of the 4 Cs. No points are also ascribed to the Madanyang heavenly star point and the Sun Sim Miao ghost point. Other functional points, the Shiklet point of the Yin Shao Mai is kidney 8. The Shiklet point of the Yin Wei Mai is kidney 9. Thank you for your attention.
Let's discuss the pericardium channel. Points overview. Tonification point, P9. Sedation point, P7. Horary point, P8. P1 important for angina point. P3 intestinal problems, blood heat. P4 main point for angina, chest pain, palpitations. P6 main for nausea point. opens chest, heart disease, calms spirit. P8 for mouth problems, heat. P9 revival point. Points of the primary pericardium channel overview, specific points according to their function. Yuan source point, P7, Luo-Connecting point, P6, C-cleft point, P4, associated back shoe point, bladder 14, associated front move point, Ren 17. 5 shoe transporting points, Jing well point, wood, tonification point, P9. Ying spring point, fire, bend point, 5 phases, P8. Shoe stream point, earth sedation point, P7. Jing river point, metal, P5. Husi point, water, P3. Way meeting point, there's none. Opening point of the yin way mai, P6. Lower Husi point, there is none. Yao way meeting point with the liver, triple burner, gallbladder channel, P1. Of the other channels with the pericardium channel, there's none. Gao Wu command point for the thoracic region, P6. Window of heaven point, P1. Points of the four C's, Madanyang heavenly star point, there's none. San Miao ghost point, P7, P8. Other functional points, important point for eliminating phlegm, misting the orifices, P5. Important point for calming the shin, P6. Thank you for your attention.
Let's discuss the sinew and Luo-Connecting vessel system of the triple burner channel. The triple burner sinew channel begins on the ring finger at the ulnar corner of the nail at TB1, travels between the 4th and 5th metacarpal bones to the wrist, binds at TB4, continues along the posterior aspect of the forearm between the small intestine and large intestine sinew channels, binds at the olecranon, ascends the posterior aspect of the upper arm to bind at the posterior corner of the acromion, traverses the posterior aspect of the shoulder and the lateral aspect of the occiput, and there meets the small intestine sinew channel. It then reaches the mandibular angle where it divides into two branches. One branch enters internally and penetrates the root of the tongue. The other branch ascends in front of the ear, binds at the outer canthus of the eye, crosses the temple, and terminates at GB13 in the frontoparietal region. There, it also meets the other hand yang sinew channels. Clinical importance. We note some pathology. Some pathology is observed when there is stiffness, swellings, and distending sensations along the course of the sinew channel, curling or contraction of the tongue. Indication predominantly for pain, stiffness, spasms, tension, and distending sensations along the course of the channel, including the lateral aspects of the head and the body, as well as the lateral sections of the extremities. TB points can also be used for muscle tension caused by emotional disorders. Owing to the connection of the sinew channel with the tongue, some TB points are also indicated for motor disorders of the tongue. Now let's discuss the pathway for the triple burner Luo-Connecting vessel system. The triple burner Luo-Connecting vessel system separates from the triple burner primary channel at its associated Luo-Connecting point TB5. It forms a three-dimensional reticulate network dividing into multiple branches and sub-branches within the surrounding tissue. Horizontal divisions run to the interiorly-exteriorly paired pericardium primary channel. They travel as a transverse triple burner Luo-Connecting vessel to the Yuan source point P7. A longitudinal division follows the posterior aspect of the arm, crosses the posterior shoulder region, continues to the front of the body, and reaches stomach 12 in the supraclavicular fossa, penetrates the thorax, and reaches the pericardium primary channel, both dispersing in the upper, middle, and lower burners. Clinical importance. Excess conditions will manifest as tension of the elbow joint. Deficiency conditions, there will be muscle weakness in the arm, difficulty flexing the elbow. These channel connections and the status of the Sanjiao as belonging to fire determine many of the actions and indications of the Sanjiao channel points, which may be summarized as follows. Reducing fever. The Sanjiao channel belongs to fire, and many of its points are indicated for febrile diseases, especially when due to exterior pathogenic factors. As far as differentiation of fevers according to the 4 levels is concerned, the Sanjiao channel primarily treats fevers at the defensive and Qi levels, whilst the pericardium channel mainly treats fevers at the nutritive and blood levels. All of the most distal points of the Sanjiao channel, where the pericardium and Sanjiao channels converge, are able to treat both. As far as differentiation of fevers, according to the Sanjiao theory is concerned, points of the Sanjiao channel mainly treat febrile diseases affecting the upper jaw lung pattern, although its most distal points also treat the upper jaw pericardium pattern. As for differentiation of fever according to the 6 channels, both the spiritual pivot and the essential question state, Ta-Yang is the opening, Yang-Ming is the closing, and Shao-Yang is the pivot. The Sanjiao belongs to Shao-Yang, the pivot between the exterior and interior, and several points of the channel are indicated for alternating chills and fever and malaria, the characteristic indications of Shao-Yang pattern. The heat-clearing action of the Sanjiao channel points extends to clearing heat from all regions traversed by the channel. Benefiting the ears. Various portions of the Sanjiao channel encircle or enter the ear, and many of its points are indicated for disorders of the ear, such as tinnitus and deafness, especially when due to heat, uprising of yang, or other excess pathogenic factors. Clearing heat from the eye, especially wind heat and liver gallbladder heat. Clearing heat from the neck, throat, and tongue, soothing the heart and calming the spirit. Due to the close relationship between the Sanjiao and pericardium channels, many points of the Sanjiao channel are indicated for pain of the chest and heart, as well as agitation, restlessness, mania, epilepsy, and other manifestations of disordered spirit. Treating headaches. Shao-Yang channel traverses the temples and side of the head, and points of the Sanjiao channel are much used in the treatment of headaches affecting this region. Harmonizing the 3 jiao. Sanjiao 5 and Sanjiao 6 especially are able to regulate the middle and lower jiao in the treatment of vomiting and constipation. Thank you very much for listening.
Let's now have the points overview of the gallbladder channel. The tonification point is gallbladder 43. Sedation point is gallbladder 38. The horary point is gallbladder 41. GB1 is good for the eyes. GB2 is indicated for the ears and the jaw. GB12 for headaches and insomnia. GB14 is good for the eyes and for frontal headaches. GB20 is the major point for headaches, for the eyes, ears, hypertension, dizziness, internal or external wind. GB21 pulls energy down, especially on the neck, trapezius problems. It's also good for menses, for contractions, for breast disorders, and for hemiplegia. GB24 is for gallbladder stuff. It's good for gallstones, for bitter taste, for jaundice. GB25 is the kidney front view point. It's indicated for problems or disorders of the adrenals. It builds kidneys and for low blood pressure. GB26 is for damp heat in the lower burner, for vaginal discharges, for gynecological issues, and for distended abdomen. GB27 is for disorders of the lower burner and for endometriosis. GB29 is indicated for hip disorders and also for gynecological problems. GB30 is for hip and back problems, and it is the main point for sciatica. GB31 is indicated for leg problems. GB34 is for muscle, tendon, and joint problems. It's also good for shoulder, knee, and back problems, for gallstones, for constipation, and sciatica. GB37 is good for the eyes and for the cough. GB39 is good for migraines. GB38 is good for migraines. GB39 is for the immune system, for bones and joint. It is specific for neck pain. It's also good for sciatica, hip pain, migraines, and inflammation. GB40 is more specific for rib pain, and it's also good for the eyes. GB41 is for breast disorders and for painful menses. GB43 is for headache, tinnitus, and dizziness. GB44 is also for headache. Now let's discuss the specific points according to their function. The Yuan source point of the gallbladder is GB40. The Luo-Connecting point is GB37. The shift left point is GB36. The associated backache point is bladder 19. The associated front point is gallbladder 24. The 5 shift transporting points are as follows. Jing point is GB44, which is a metal point. The Ying spring point is GB43. It's also a tonification point and a water point. The shoestring point, which is a wood point, and the bend point of the 5 faces is GB41. The G river point, which is also a 5 point, and the sedation point of the gallbladder is GB38. The Hussey point, which is the earth point, is GB34. The Hui meeting points are as follows. With the Sinew, it's GB34. With the marrow, it's GB39. The opening point of the daimai is GB41. The lower Hussey point of the gallbladder is GB34. The Zhao Hui meeting points are as follows. With the SI and triple burner channel, it's GB1. With the triple burner and stomach channel, it's GB3 and GB4. With the triple burner, large intestine and stomach channels, it's GB5 and GB6. With the bladder channel, it's GB7 and GB8, GB9 and GB10. With the bladder, SI and triple burner channel, it's gallbladder 11. With the bladder channel, it's GB12. And with the Yang Wei Mai, it's GB13. With the Yang Wei Mai, which includes triple burner, stomach, and LI channels, it's GB14. With the Yang Wei Mai and the bladder channels, it's GB15. With the Yang Wei Mai, it's gallbladder 16, 17, 18, and 19. With the Yang Wei Mai, Yang Chao Mai, and the triple burner channels, it's gallbladder 20. With the Yang Wei Mai, triple burner, and stomach channels, it's gallbladder 21. And with the bladder channel, it's gallbladder 23. With the spleen channel and the Yang Wei Mai, it's gallbladder 24. With the Dai Mai, it's gallbladder 26, 27, and 28. With the Yang Chao Mai and Dai Mai, it's gallbladder 29. With the bladder channel, gallbladder 13. With the Yang Wei Mai, it's gallbladder 35. Of other channels with the gallbladder channel, which includes stomach 7, stomach 8, stomach 9, stomach 12, SI12, SI19, bladder 1 and 11, bladder 31 to 34, pericardium 1, triple burner 15, 17, 20, and triple burner 22, liver 13, do 1, do 14, and do 20, stomach 5, stomach 6, and stomach 30. No points were ascribed as the Gao-Wu command point. The window of heaven point is gallbladder 9. No points is also ascribed as the point of the four C's. As for the Madanyang Heavenly Star point, we have gallbladders 30 and 34. There is no point ascribed as the Sun Se Miao ghost point. The other functional points, main point for disorders of the head and sensory organs and the brain is gallbladder 20. The front midpoint of the kidney is gallbladder 25, and the cheek left point of the yang wei mai is gallbladder 35. Thank you for listening.
Let's discuss the points of the eye system. Bladder 10, Chan Sui, Heavenly Pillar. Location approximately 1.3 tune lateral to Do15, where the trapezius muscle inserts on the lower border of the occiput, close to where the major occipital nerve emerges. How to find with the patient's head in an upright and relaxed position. First, locate GB20 below the lower border of the occiput and between the insertions of the sternocleidomastoid and trapezius muscles. From there, palpate in a medial and inferior direction at a 45 degrees angle until the finger comes to a halt against a bulge of the trapezius muscle. This is the location of bladder 10. For reference, if the practitioner places their left middle finger on GB20, the shorter index finger will be pointing to bladder 10. Located on the same level is Do15, approximately 1.3 tune lateral to the midline and superior to the axis. First palpable spinous process. Needling 0.5 to 1 tune vertically or slightly oblique in a dorsal direction. Caution, do not needle in a superior direction. Actions indications regulates the qi, calms wind and the shen, benefits the head and sensory orifices, opens the channel, strengthens the lower back, expels wind. Special features, window of heaven point, important point for expelling internal and external wind. In contrast to GB20, bladder 10 is used in clinical practice mainly for pacifying internal wind. Extinguishes wind and subdues liver yang for dizziness, muscle cramps, stiffness of the neck with inability to turn the head, headache, feeling of heaviness of the head, epilepsy. It expels exterior wind in aversion to cold, fever, body aches. Strengthens the greater yang channel in inability of the legs to support the body, soft legs, weak legs that cannot sustain the body. Clears the brain in mental confusion, difficulty in concentrating, and poor memory. Opens the sense orifices in eye pain, red eyes, blurred vision, lacrimation, difficulty in speaking, nasal congestion, loss of sense of smell. Removes obstructions from the channel in pain in the body, pain in the shoulder and back. Opens the mind's orifices in manic behavior, incessant talking, seeing ghosts. Small intestine and bladder pertain to greater yang, which opens on the exterior. On the three yang, the greater yang channel are the most yang or most exterior. In addition, the area on the top of the body, like the occiput, is even more yang in relation, for example, to the inferior part of the bladder channel. This has two main implications. On the one hand, it means that the points in this area are yang in nature and can therefore be used either to tonify yang, inability to support the body, or to expel yang pathogenic factor such as wind in epilepsy, stiff neck. As bladder 10 is situated at the point where the bladder channel and the eye system emerge from the brain, this point can be used to clear the brain and stimulate memory and concentration. It has a special effect on the eyes and is used to increase vision, especially in the eyesight is diminished from kidney deficiency. Expels wind from the head Bladder 10 is a major local point for occipital headache or vertical headache with stiff neck. It has a special effect on the eyes and is used to increase vision, especially if kidney deficiency is contributing to the eyesight problem. Distal point for acute lower backache. Window of the sky, point of Sea of Qi. This window and Sea of Qi point can be as powerful as the kidney chest point, kidney 22 to 27. It treats the spirit of the bladder, clears the brain, and stimulates memory and concentration, gives a new perspective on a person's life if living under a cloud of fear. Pillar in the same way refer to the trapezius muscle which support the head as it treats disorder of the neck, also named after a star, thus indicating its spiritual quality. Thank you for your attention.
Let's discuss the TCM diagnosis for cough. Cough can be diagnosed according to its sound, the time of occurrence, and the character of any sputum. As a general rule, a weak-sounding cough indicates deficiency, while a loud cough indicates excess. A barking cough denotes heat, while a loose, rattling cough indicates the presence of phlegm. A cough that occurs only in the late afternoon or evening indicates indeficiency. A cough that is worse in the morning is usually due to phlegm. A cough without sputum indicates either deficiency or heat. If there is abundant sputum, it is due to phlegm. A yellow sputum denotes heat, while white sputum denotes cold. White sputum may be sticky or dilute. If it is sticky, it indicates the prevalence of dampness and phlegm over cold, while if it is dilute, it indicates the prevalence of cold over dampness or phlegm. Blood-tinged sputum indicates either full or empty heat. Greenish sputum indicates heat, while white, very watery, and frothy sputum indicates phlegm fluids. So here we have the diagnosis of cough. So first, we need to determine if there is the presence of sputum. Without sputum, so it's definitely due to deficiency or heat. If there's abundant sputum, then you have to qualify whether there is phlegm. And for phlegm, you have to determine the color of the phlegm. White means cold, yellow means heat, blood tinge can be either full heat or empty heat, greenish is heat. So for white phlegm, which is cold, you need to further subdivide it into sticky, which indicates dampness or cold, dilute, cold or dampness, watery, frothy, phlegm fluids. Thank you very much for your attention.